Hi, this is Bill Wiley. We're here in Barcelona. We're going to talk to Dr. Kanellopoulos from Athens, Greece, and New York City, and he's going to talk to us about a new keratoprosthesis. Just gave a great talk on that. It's really exciting and interesting. Tell us about this.
Yes, Bill, thanks for asking me. I've worked with severe external disease patients for a while, and I actually was fortunate to train with Klaus Dollmann in Boston on the Boston keratoprosthesis. And one of the issues with the traditional keratoprostheses is that they're penetrating procedures. They carry a very high risk of endophthalmitis. Yes. Among the usual things, glaucoma, cornea melts, etc. Sure. Keramid, which is an American company, works with a model prosthesis that's actually very novel as far as the way it works. It's an inlay, yes. So you create a pocket within the diseased cornea. And then the prosthesis is of a foldable material, so the incision has to be quite small. It's placed within the 350 initially, in the newer model 400 micron depth. And then there is a central trephination of about 3.5 millimeters, out of which the optic part of the prosthesis protrudes.
I see, okay. And then how is that pocket created? Is it blade or femto, or are these corneas accepting of a femto? Are they...
Right. It's a very good point. The ideal scenario is to create it with a femtosecond laser, and it's surprisingly, it's not that difficult, even in corneas that are relatively not very translucent, as we're used to in refractive surgery. To create a pocket, you can do a double pass on your femtosecond laser. I use the Wavelight Alcon FS200 femto, which gives a very nice pearl to the pocket. I use the venting chimney for the lamellar cut as the entry point to place the prosthesis in. That's great. And another thing we've involved in technique is cross-link these corneas before the central trephination of the optic part is performed, thus making more resistant to melt and erosion. Sure.
That's great. And then the device itself, it's foldable? So is it, what's it made of? Is it silicone? Or?
It's of a proprietary for Keramid hydrophilic acrylic material. Okay. It is foldable. It resembles a foldable intraocular lens. Sure. It has a central optic and then a peripheral disc, which is fenestrated in order to allow fluid and nutrition to go through the cornea. It is obviously intended for patients that have severe external disease and problems epithelializing. We started using it with a permanent contact lens. Actually, the contact lens was not permanent, its use was permanent, so changing the lens every month. Now we're seeing that the newer model, the Clear 2, can probably tolerate an environment where the contact lens is placed only for the first few weeks and then no contact lens. Sure. And it appears that the optic part of the prosthesis does not become epithelialized so far. So I think it's a valuable alternative to some of these very diseased eyes, and definitely an alternative in countries where the availability of cornea tissue is not that easy as it is in the United States.
Sure. And is it full thickness then, as far as the posterior portion too? I know it protrudes anteriorly. Is it also... Right. Okay.
No, the inlay stops posteriorly at 400 microns.
Oh, I see. Okay.
So this will be intended in corneas that do have a functional endothelial pump to keep that residual stromal bed behind the prosthesis clear. And we've tried this, and we reported this actually a few years ago with the older version of the Keraclear, the cornea is not endothelial functioning. You can place the prosthesis on the donor cornea and then transplant the donor cornea, donor vehicle cornea prosthesis as you were transplanting a normal cornea.
That's great. That's exciting. Now, when do you foresee that we'd see it here in the U.S.?
I know there's a discussion of doing a U.S. FDA trial, I assume within a couple years, but I know it's been in use in Europe. Jorge Alio uses it in Alicante, Spain. Jose Vargas is doing a lot of work with it in Colombia. So there's several centers that address severe external disease that have used it, and I know that it has anecdotally been used in very advanced keratoconus as well, as an alternate to penetrating keratoplasty.
Great. Well, that's really exciting. Thanks for sharing your experience, and thanks for being with us today.
Oh, sure. Thank you very much.
Appreciate it.
My pleasure.